Last question for you, Dr. Patel, and then I promise I've got an overlapping one for you and Dr. Antonoff. Uh, you know, one of the problems, even in our modern day, so the big International Association for Study of Lung Cancer, IASLC, they put out a global survey about biomarker testing, right? The results were just published from 2024. And what we found is that 43% of doctors, 43% as of even 2024, are going ahead starting a treatment for a patient with non-small cell lung cancer without even having biomarker testing results available. What do you think are the barriers? How do we overcome that?
So I think one of the big issues is the time to getting your test results, right? I think a lot of times, I mentioned the frustration as a patient, right? You're just waiting. What do you mean I have to wait 3 to 4 weeks to get started on treatment? That seems silly, right? Like I have cancer, I need to get started on treatment. But waiting for that biomarker testing can be also important because it can really shape and change how we do a patient's treatment. So I think one thing is that waiting situation. And I think the other part of it is a lot of times, sometimes patients are really sick and, oncologists feel that, the need to consider starting treatment. And I think that, starting certain chemotherapies if we have to because there's impending organ failure sometimes does make sense. But I do think that, the access to the biomarker testing is there. Most companies have really tried hard to partner with all of the practices that don't have access to it, maybe in-house, to make sure that they have the availability. I think it's more about knowledge and continuing to create awareness about how every lung cancer patient deserves biomarker testing.
Yeah, thanks for emphasizing that. And, I think a big component of this is also just awareness, education, right? That's why events like this are super important, even on Saturday mornings, when we're all up and early and devoting our time and working together to kind of engage and empower. So, thanks for that message.